typically what will happen is with 5-HTP, and this is how you want to dose your patients with it, is they need to take 5-HTP 30 minutes before they go to bed on an empty stomach with a little bit of juice, preferably grape juice. If you have a diabetic patient that's really sensitive, then use instead of 4 ounces use 2. If they're very, very sensitive, have them take it with water. The juice allows it to be able to get into the brain quicker. Now, there's other authors out there say you don't need to do that. I'm telling you from doing thousands of folks, I find this is the best way to do it. So typically what should happen is the patient should take start with 50 milligrams of 5-HTP 30 minutes before bed on an empty stomach, which means an hour and a half after they've eaten anything, with a little bit of juice. The juice causes the body to release glucose. Glucose causes insulin to be released, and insulin pulls the 5-HTP past the blood-brain barrier into the brain. 5-HTP, in my opinion, should not be taken with anything else, including B6, especially at bedtime. B6 can shunt 5-HTP into the digestive system. Remember I talked about 5-HTP, I talked about serotonin and the serotonin receptors in the intestinal tract? Well, part of what 5-HTP is, part of what B6 does is shunt that. So I would not take a combination formula, personally. I would not recommend that. I know doctors are doing that. You just want to use pure pharmaceutical-grade 5-HTP, nothing else. Now, one of 3 things happens when they take this 50 milligrams of 5-HTP. The first thing is nothing, and that's to be expected because it's such a low dose. If the second thing that may happen is they take the 50 milligrams, they fall asleep within 30 minutes, and they sleep through the night. Beautiful. That's the dose they need to stay on. However, more than likely what's going to happen, they're going to take it, they're not going to notice any difference in their sleep. Now realize this, everybody with fibromyalgia has a sleep disorder. And it's the first key that you have to use. It's the first door you have to unlock to get these people well. If you don't get them going into deep restorative sleep, you may help them a little bit, but not anything lasting, not anything that's going to make a difference in their life. Sleep is the key. And that's why we're going to spend a good bit of time on that this morning. If they don't fall asleep within 30 minutes and sleep through the night, they keep increasing their dose by 50 milligrams. Each night they add additional 50 milligrams until they fall asleep within 30 minutes and sleep all the way through the night. 5-HTP will never leave them feeling hungover, dopey, weird, strange. If they need to get up in the middle of the night, take care of an invalid family member, or maybe take care of a small child, they'll be able to do that, and they should be able to go right back to bed. That's the beauty of 5-HTP. Now, for the weirdos, and there are, these people with fibromyalgia, they can be wackos. I love them, but even when I go out and speak, I tell them I know you're a bunch of wackos, because they are, because some of them biochemically are so screwed up that they get opposite reactions when you use not only prescription medications but also nutraceuticals. So some of your patients, when they take 5-HTP at bedtime, instead of putting them to sleep, it's going to wake them up. And typically those are going to be people that have chronic fatigue syndrome, because those with chronic fatigue syndrome typically have a sluggish liver. That's part of their problem. Now you'll know that in your intake form, especially if you're using any of my material, because in my questionnaire out of the doctor's manual, and I'm not sure if it's in this, but one of the things we look at is we ask, you ask your patient is, do you have any opposite reactions? Do you have funny reactions to medications? So they'll let you know that right away. Do you have a real strong sense of smell? Do smells bother you, and has that gotten worse over the years? What is smells? I mean, smells is still a chemical, right? It's still, you smell it, it's a chemical, still has to be processed by the liver. So individuals have a real hard time with smells. They can't walk in Office Depot or with a lot of noxious smells. Those individuals oftentimes have a sluggish liver. Individuals who have they use the bathroom after eating asparagus and they get a strong odor. So these are all clues. And when you treat these people, you got to think like a detective. You got to look for these things. What is that a sign of? That's a sign of molybdenum deficiency, because when you eat asparagus and you urinate, you get this, and if you have a strong smell after that, it means you're dumping out a lot of sulfur. So you get this strong odor. Individuals who have trouble eating onions, raw onions, not cooked onions, right? And you'll see these patients, they'll come to the office, they'll say, when I eat raw onions, I get rapid heart rate. So I get a vagal response, which is an allergic reaction. And what is that a sign of? That's a sign that they have a problem of sluggish liver, typically because they don't have enough sulfur to break, and they don't have enough of the amino acids and other cofactors to be able to break down the sulfur in raw onion. So these are all little clues that you can pick up that you want to use. But typically, 99% of the people taking 5-HTP, it's going to work. Can they take it with prescription medication? Only if they want to get well. No one has an Ambien deficiency. There's only 4 prescription medications that put somebody in deep restorative sleep, by the way. What are those medications? Well, Ambien's one of them. The old tricyclic drugs, Elavil, antidepressant, and trazodone. Flexeril, which is Flexeril is very similar to Elavil, but it's a muscle relaxer. And then the new sleep drug, Linestra. Those medications do allow a person to go into deep delta wave sleep. The problem is several. If we have someone taking Elavil, now remember, Elavil is a tricyclic antidepressant. It's trying to help them hang on to serotonin longer. But the problem is they don't have any serotonin, right? We'll go back to what we're talking about. But they may be taking a sleep medication, and they may go into deep restorative sleep, and they may get their stress coping savings account up to here. Well, all it takes is to get into Pittsburgh morning rush hour traffic, and bam, they crash again. And if we look at the potential side effects of these medications, here are the potential side effects of Ambien. Number 1, it should not be used longer than 2 weeks because it has a tendency to cause memory loss, amnesia. The number 2 side effect of Ambien is flu-like symptoms. And other symptoms associated, side effects, anxiety, depression. Now what are those? Those are all symptoms of what? Fibromyalgia and CFS. Elavil. What's the potential side effect of Elavil? Well, one of the things, it squashes melatonin. Flexeril. What's one of the side effects of Flexeril? Depression, fatigue, lethargy. Sleep interruption of circadian rhythms, meaning it changes your natural, innate, inborn sleep patterns. So these medications can never be better, in my opinion, than using the raw ingredients like 5-HTP and all the things that non-allopathic and integrative medicine doctors have been talking about for years. Now, question. Can a patient take 5-HTP and Elavil? Absolutely. Can a patient take 5-HTP and a selective serotonin reuptake inhibitor? Despite the warnings out there, absolutely. And now in my first book, that's a public book, it's in the public domain, I say don't do that unless you consult your doctor. Now I do that for liability reasons. However, in my practice, which is largely 90% of it is fibromyalgia, maybe not that much now, but majority of those people are all on antidepressants. I mean, everybody in your practice is on antidepressants. And all of my patients are taking, the majority of my patients are taking amino acid therapy. 5-HTP, SAMe, DL-phenylalanine. They're all I'm using orthomolecular high-dose amino acid therapy for these people to normalize their neurotransmitters, even though they're on prescription medications. Why? Because those prescription medications are gasoline additives, and they don't have any gasoline. It's not doing anything anyway, right? If it was, they would be well. They wouldn't need to be in your office. So absolutely you can. Please do. Please don't be discouraged from using amino acid therapy along with antidepressants or sleep medication. And eventually, what you'll be able to see is you'll be able to help them wean off of these medications over a period of time.